Good morning, everyone. You are very welcome to the launch of the HSE Social Prescribing Framework. Before the webinar begins, a little bit of housekeeping. We are in Zoom webinar format, therefore during the webinar you can use the Q&A feature, which is located at the bottom of your Zoom window on your PC or laptop to direct any questions to our panel. If you are using an iPad, you will find these features located at the top of your screen. Without further ado, I would like to hand you over to the Programme Manager for Mental Health and Wellbeing, Anne Sheridan.
Good morning, everyone. You're all very welcome to the launch of the HSE Social Prescribing Framework. I'm Anne Sheridan and work as Programme Manager for Mental Health and Wellbeing, and it has been my privilege to support the development of social prescribing for many years now. So it's been quite the journey so far. Many of you today have been on that journey, and that got me thinking about that often asked question, are we there yet? I believe we're well down the road. And while it's true that we've travelled some bumpy roads with poor road signs, we're heading, I believe, towards the motorway. We will all arrive there eventually. But once there, the road signs get better, the hard drive will be over, and the road ahead will be clearer and smoother so that we can continue the journey with everyone safely on board. Today, over 1,000 of you have registered for this event, which is an absolutely amazing testament, I think, to the interest and support that there is for social prescribing from very many sectors. I think it's fair to say that social prescribing is finally on the map. And I am really moved by today's response. So thank you all very much for joining us today. We have a really busy packed agenda for the next hour and a half. And I'm really delighted that we've been able to include the voice of 3 service users, 3 people who've used the social prescribing service through 3 short videos, and we'll show those to you during the course of the event. As Helena said, please flag any questions you have in the Q&A function, and hopefully most of them will be answered anyway in the course of the webinar today. But if they haven't, we will club them together and we will send out a response in the coming week. If you're using social media, please use #SocialPrescribingIRL. So on to the agenda. First up this morning, to make some opening remarks, I'm really delighted to introduce to you Dr. Philip Crowley, National Director for Strategy and Research in the HSE. Philip, you're very welcome.
Thank you very much, Anne. And what a milestone it is today. Yeah, I'm the new National Director for Strategy and Research. Previously, I was Director of Quality Improvement and Quality and Patient Safety. And but I'm a GP working in the homeless service, and I've been aware of the strength of social prescribing for a long time. I worked in the inner city in Newcastle and created links between community organisations and the health service there. And I also worked in Central America, Nicaragua, and worked a lot with the community organisations there also. So it's a core kind of principle of mine that I think the health service can achieve so much more in partnership with the people who use it, and particularly in partnership with the communities where they reside. So I think this is a massive step forward today in crystallizing that potential. The power of the community to improve their own health and well-being is way greater than anything we can do on our own. So I think social prescribing is potentially going to transform the experience of people of their own health and well-being. And I think today is a big step forward in that journey, as Anne has already referred to. I think the family resource centres have been really key, and the local development companies have really shown leadership in this space. And I really appreciate that. You know, this partnership potentially unlocking the relationship between HSE, which is such a big organisation, and community and voluntary organisations. The potential is almost limitless, I think. And we really want this framework to help integrate social prescribing into our health service. I think we learned a little bit today about the social prescribing link worker, and I think their role is really going to be pivotal. And the investment in that role will really make this happen, I believe. We're going to see it really embedded in community healthcare networks and in the 19 healthy community sites. So I think that will be where we'll see this model really evolve. I'd just like really to finally really thank everybody who's put so much work into this, to the steering group, to the excellent health and wellbeing team. I couldn't be more enthusiastic about today's launch. We're going to really put all of our commitment behind this, and I really believe that this initiative to really embed social prescribing in our health services will be transformative and will really enable communities and citizens in communities to really take up the reins and take control of their own lives and help them take control of their own lives and of their own determinants of their own health and well-being. So thank you so much for including me in the agenda today, and I really look forward to hearing the various presentations. Thank you very much.
Thank you very much, Philip. And I think the audience will be very pleased to hear your enthusiasm, and particularly your recognition of the value of the partnership between the HSE and community and voluntary sector in really improving the health and well-being of the population. So thank you very much for that. Now we're moving on to the first video. And as you said there, Philip, it's important to hear from link workers. So we're just about to hear from Deirdre Ruan, who is the social prescribing link worker working in Tala, and she's one of 30 or more social prescribing link workers working around the country.
My name is Deirdre Ruan. I'm the Social Prescribing Coordinator with South Dublin County Partnership. It's actually a great service to have available in the community because I'm like the conduit between the primary care team and the community services. So the aim of social prescribing is actually to link people with local services. So typically I receive my referrals via a software, a social prescribing software, so it arrives into my inbox and I get all the information I need to know about the person. So then I ring up the person, and through a series of chats and talks we discuss what concerns they have, and I kind of do a general well-being score to start off with, and they tell me what their goals are. Maybe they'd like to make changes in their life, or they'd like to find renewed purpose in their life. Now these people can be any age, over the age of 18 upwards, so it's for everybody. So social prescribing is very much the first step for somebody that mightn't have been engaging in community activities before, and it facilitates that engagement. A social prescriber will be with that person for a period of weeks once they're referred by their GP or local community service, and they'll stay with them until they get engaged. And that's invaluable to be linked with local supports. And also it can reduce the number of visits to the GP, I suppose, because their health and well-being is much better linking in with courses like connecting with nature, being out and about, particularly during COVID, linking in with walking groups, and we call that the green prescription. And for all social prescribers, it's probably been the most important thing that we all can link in with and we all advocate.
Okay, so that's, I think, a great description of the role of social prescribing. It's only a very brief description, but I think it sets the tone for what social prescribing is all about. I'd like to acknowledge Deirdre, who along with Amanda Caulfield, who is another social prescribing link worker, they represented all of the link workers on the National Steering Group, which is the steering group that guided the development of the framework today. So now I'd like to move on and introduce a recording of Minister Frank Feighan, who will launch the framework. He was unable to join us in person today, but we're really grateful that he recorded his official launch of the framework. So I'll pass over to him now.
Apologies, Anne, we appear to be experiencing some difficulty with the Minister's video, if you can bear with me.
Okay. Folks, sorry about this. We'll get this sorted. I might just say in the meantime that that we had a steering group that informed the whole development of the framework. And the steering group is made up of representatives from the HSE, because, as you know, one of the thrusts of the framework is to really integrate social prescribing within many services within the HSE. But we were also delighted that within the steering group that we had representatives from the community and voluntary organisations that are pivotal and core and central and foundational to the whole idea of social prescribing. And in a few minutes, you'll hear from two of those. And so I'd like to thank all of the members of the steering group for their work over the last number of months. In fact, we started this process back last September, so it's been a busy time. And aside from the meetings that we've had with the steering groups, we had many consultation events and stakeholder sessions where we really teased out the potential of social prescribing to work in this integrated way within the HSE. So over to you, Helena, and I'm hoping that you've managed to get the video.
Apologies about this, and there appears to be an error with the video.
Well, shall we move on to the next item?
Helena,
can we move on and show the video of Frank?
Yes, I'll share that now. Thank you.
Okay, so maybe I'll just introduce that. So as I said at the outset, we had the opportunity to go out and in partnership with link workers, video and hear the stories of some people who've actually used the service. So I'd like to introduce Frank, who is availed of the social prescribing service in Tallaght. So enjoy.
My name is Frank Feighan, and I was with Dr. O'Connor's surgery for a long time, but one day I went to the surgery, asked me about walking, was I interested, and through that I was introduced to social prescribing, and it was from that then I took up the walking once a month with the group. It lasted for a while, but unfortunately COVID came along and I had to learn how to get into Zoom, which I had never done before, so it was a whole new aspect for me. And each Friday then we would do the Zoom meeting. And then one day we decided that, you know, after a couple of months on the media, that we do virtual walking. So for a bit of fun, just to get out, you know, we thought, well, let's all get together. Let's do virtual walking in the house, up the stairs, in the garden, wherever. And we'll add them together and we'll make the mileage. And we got down to Tramore, which is where I like being. So through it, we got to know each other, we got to know places, and it was very enjoyable. Very relaxing being able to do it, because once I was talking about Tramore, or people were talking, you could visualise yourself in the place and it relaxed you more. And then from that, we said we'd walk around Ireland. And then we went on to WhatsApp, which we learned how to do WhatsApp. And we sent each other pictures of nature, pictures of people baking and different things. And that in itself was great. You know, social prescribing, I would recommend it to anyone. You know, it's really a way forward. It's better, although you're going to your doctor, it's a better tonic than the medication you get, you know, to me.
Isn't that a fantastic and powerful example of how social prescribing has worked and responded during COVID particularly? Introducing people to Zoom and to social media as a way of staying connected. What I love about that story from Frank is that he started out the journey in social prescribing and started walking as part of that, but then assumed and went into this kind of leadership role and volunteering role himself, where he actually then, through social media, had the virtual walking group, and he organised all the virtual walks. So I think it's a really brilliant example of just the benefits that can be achieved through social prescribing. And I really want to acknowledge all of the social prescribing link workers at this point in terms of just how incredibly responsive they've been through COVID. It's been a hugely challenging time for everyone. But I think they're a really brilliant example of how people have stepped up and just done business differently, because that's what needed to be done, and respond to just the emerging needs that were happening. So I just want to say a big thank you to all the link workers for the amazing work they've done around this time. Okay, so now it's time to hear about the framework itself. So perhaps we'll go ahead and do that, and hopefully we'll have the Minister following that. So no better person to hear about the framework or to tell you about it than the main author of the framework itself. And so I'd like to introduce my colleague, Orla Walsh, Project Manager in Mental Health and Wellbeing.
Thank you, Anne. I'm just going to share my screen. This will take a moment or two. Bear with me. Is that visible, Helena?
Yes, Orla, thank you.
Okay, perfect. So thank you for the introduction, and I'm going to give a very brief 10-minute overview of the HSE Social Prescribing Framework, a brief overview of how it was developed, what it is, and who might find it useful. I believe that Jean has just put the web link to the framework document into the Q&A box at the moment, so I'd encourage people to check it out after the webinar, because I'm going to be just scratching the surface in my short input today. So I suppose before we get into the framework, I think it's really important to reflect on the development of social prescribing in such a short space of time. Over the last 9 years, huge progress has been made, and I really want to give a very big shout out to all the local champions at community level in family resource centres and partnership companies around the country who have been, you know, advocating and championing for social prescribing over the years. It really is now regarded as a ground up movement in Ireland, and there's been huge strides made in a very short time. From the starting out of the blocks at the start were our friends in Mayo in 2012 with the first social prescribing project up there, and Donegal followed on. I think the establishment of the All-Ireland Social Prescribing Network in 2018 was a really important milestone, because on foot of the network, a number of All-Ireland conferences were held, which really helped share the learning, attracted a lot of attention from, you know, commissioners and policymakers. Certainly the Department of Health's Launch Care Integration Fund and the Healthy Ireland funds both really elevated social prescribing because they provided much needed funding for the growth of social prescribing services around the country, and we now have 30 plus social prescribing services up and running around the country. Social prescribing has been referenced in a number of policy documents, such as Sharing the Vision, our programme for government in 2020 referenced social prescribing, as well as the recently launched Healthy Ireland Implementation Plan 2021 to 2025. And here we are today at the launch of the HSE Social Prescribing Framework. So the framework essentially outlines a common approach for the delivery of social prescribing within the HSE. It's not intended to be a prescriptive document, because social prescribing builds on local assets which are unique to each community. So variation in what social prescribing looks like is to be expected. However, we have learned an awful lot over the last 10 years in Ireland about what good social prescribing looks like, and we've learned a lot as well from our colleagues in England, in the NHS, where social prescribing is now embedded within the primary care infrastructure over there, and those learnings are very much reflected in the framework document. So Anne gave an introduction at the start about our steering committee. And I suppose it's important to mention, when we issued the invitations to participate in this steering group back in September, we got immediate responses from all of those we asked. There was such enthusiasm for this whole area. Our colleagues across the HSE and across the community and voluntary sector really wanted to see how social prescribing can be mainstreamed and the partnership could grow between the HSE and the community and voluntary sector. I should mention we also had a service user, George, on our group. He was so busy pursuing all of the interests that he had come to love as a result of social prescribing that we met him once or twice, but it was great to have him involved. He was a busy man. We also, I want to give a shout out to Craig Lister. I hope you're listening, Craig. Craig is working in NHS England. Craig has been was centrally involved in advancing social prescribing in England. And we had some of Craig's time at the development stage, which was really, really helpful. So thank you, Craig. The delivery model that's set out in the framework is for social prescribing to be delivered at local level by community and voluntary organisations through grant aid agreements with the HSE. So social prescribing link workers will be recruited, employed and hosted by community and voluntary organisations. And that by and large is currently how social prescribing is currently operating across in the main across many of the locations in Ireland at present. In the framework, we're proposing a social prescribing link worker per community healthcare network. For those of you outside of the health service, just a brief description of what a community healthcare network is. So this is how our health services are going to be delivered at local level. There will be 96 community healthcare networks across the country. They're being rolled out at present. And within each community healthcare network, there will be 4 to 6 primary care teams. Social prescribing under the Healthy Communities programme will cover a community healthcare network while prioritising the actual geography of the healthy community site, which is smaller, and it serves a specific area of deprivation within the community healthcare network. This is a visual of the referral pathway and the framework document. When you get a chance to have a look at it in greater detail later, goes through each of these each of these stages of the service user journey in a little bit more detail. So I suppose just in terms of the service users, social prescribing is open to anyone over the age of 18. Often participants might be people who are lonely, who are isolated, who might have chronic health problems or might have mental health challenges. Referrals can come from a very wide range of professionals, from health professionals to community professionals, and self-referrals are also accepted into social prescribing. As part of the referral pathway, we encourage a feedback loop to the GP with the consent from the participant. So Anne mentioned at the outset, and we saw that video of Deirdre Owen, a social prescribing link worker, and I suppose we can't underestimate the value of the role of the link worker. Social prescribing is much more than signposting. The link worker works in close collaboration with the person over a period of time using a personalised coaching and co-production approach to develop a plan to help that person improve their health and well-being. They may have 8 or more contacts with that person throughout the course of the intervention, if you like. And the aim is to connect people with sources of support within their local community with the purpose of improving their health and well-being. These local supports can be really broad and varied, from park run to men's shed to it depends what's available in the locality. It's really, really broad and diverse. And I think one of the most powerful testimonials we've heard from a service user with regard to their interaction with the social prescribing link worker is that the focus was on what mattered to them, not what was the matter with them. And I thought that was really, really powerful, that testimonial. I think it's important to reference that social prescribing has the potential to address those wider determinants of health. It's not just about social support. When I was preparing for this presentation today, I put a call out to our Sláinte Care funded social prescribing projects, just for some examples to hear from them about how in their work they've been able to work with service users to address those wider determinants. Because we know from the English experience that debt and housing are some of the 2 key issues that people are presenting with when they engage with social prescribing. The problems in this area. And I got a plethora of examples back from social prescribing link workers about how they've helped people to navigate housing services, help them complete housing applications for housing assistance payment, help people re-engage with the workforce, returning to work after unemployment, supporting them with CV workshops and interview skills. And this was just 2 of the examples we came up with. So really, really impressive work. I'm not going to focus too much on evaluation today. Some of you may have participated and joined our webinar launch of this document back in September of 2020. We have launched an evaluation framework for social prescribing, and within the framework that's being launched today, we're endorsing that are recommending that 2 minimum outcomes related to personal well-being and social connectedness are collected as part of each service user journey. If projects or services have the capacity to collect more than this, then we'd absolutely encourage them to do so. And look, you heard Frank there earlier, and you'll be hearing from more service users later. The power of the story of the service user and that qualitative data can't be underestimated. We spoke to many of our colleagues across the system in various corners of the organisation that's represented on this slide about how social prescribing could align with their work, access points and routes of referral between all of these services and social prescribing. And there was huge enthusiasm from everyone we spoke to about the potential for social prescribing to broaden the range of support that the health service can offer to our service users. We'll hear from Dr. Derek O'Keirda later on in the webinar about how GPs have found social prescribing such a useful tool. Derek talks about how 20%, according to the research, 20% of people present to primary care with what is not a non-medical issue, which is social in origin. And it's really hard for GPs to be able to open that Pandora's box and address these issues, but social prescribing provides them with the tools to be able to do that. Similarly, in health and well-being, a major priority for us in health and well-being is the prevention and management of chronic disease. And social prescribing link workers are already working with our self-management support programs at local level to help address those wider issues like loneliness and isolation that people with chronic illnesses often present with. So in terms of implementation, the Healthy Communities programme referenced earlier will provide sustainable long-term funding for social prescribing in targeted areas of disadvantage. Implementation will start this year across 19 sites, and there will be further expansion over the next 2 years as part of the Healthy Communities programme. I'm going to finish up there. I just want to say thank you so much for your attention. I'd encourage you to have a look at the framework and to engage with myself and Anne if you have any questions. And thank you again.
Thank you, Orla, for a great presentation and for all your hard work in getting to this place today. We're still working behind the scenes to bring you the Minister's presentation, so hopefully we'll have that sorted before the end of the webinar. As you know, social prescribing is grounded in a partnership between the HSE and community and voluntary organisations. And we're now going to hear from two of those organisations. Shauna Diamond from the National Family Resource Centres and Jennifer Darcy from Bray Area Partnership. Shauna's input is pre-recorded, and this will be followed immediately by Jennifer, who's here with us today. So I'll hand over to Shauna, first of all.
Hi there, my name is Shauna Diamond and I'm the National Programme Manager for the Family Resource Centre Mental Health Promotion Project. And I want to say a massive thank you to Anne and Orla and congratulations on the launch of the Framework for Social Prescribing today. It's been an incredibly fruitful and collaborative journey working with everyone on the steering committee since last autumn. And I'm proud to be representing the National Forum of Family Resource Centres and FRCs across the country and ensuring their voice was part of the development of this framework. There are over 121 family resource centres across the Republic of Ireland. And FRCs are based in some of the most marginalised communities where poverty, social isolation, health inequality and unemployment are weaved into the everyday lives of the communities FRCs support. The ultimate aim of the programme is to combat disadvantage within the community. And FRCs work to achieve this by involving the communities they support, working closely with other community and voluntary organisations and statutory agencies to develop a coordinated response. And evidence suggests that this wraparound community-based support is the best way to create and sustain resilient individuals and communities. FRCs are the only national programme with a drop-in service to the public, and as a result are often presented with a wide range of social issues. Often underpinning this is mental health challenges, and FRCs can be the first point of call for people in distress. Supports are available across the life course, and these include in-house counselling and therapy, family support, wellbeing programmes, and support with finances and employment. FRCs are ideally placed to facilitate community-based responses around mental health and wellbeing, resilience building, suicide prevention, and social prescribing. The national network offers an infrastructure that can develop the delivery of national strategies, including Connecting for Life and Sharing the Vision, along with mental health and wellbeing initiatives, including the forthcoming Healthy Communities. They also offer a platform for mainstreaming the promotion of positive mental health and wellbeing in existing services. FRCs are already the largest provider of social prescribing in Ireland. We have 20 FRCs offering this service. These range from Waterford, Donegal, Dublin, Cork and Kerry, and many other counties in between. These services are funded through Sláinte Care, through Healthy Ireland and the HSE. And in 2020 alone, FRCs supported just under 50,000 people across the country. Many of these people fall into the vulnerable category in Sharing the Vision. And this reach to vulnerable individuals demonstrates the potential positive health impacts FRCs can have on individuals and whole communities when they are resourced to do so. The interconnection between these supports and social prescribing is paramount and has a massive impact on a person and a community. FRCs already have the established supports and services in place to meet the needs of service users of social prescribing projects. And I think that's the beauty in this. The aims of FRCs align with the principles of social prescribing. Both services aim to combat stigma, improve social connectedness, provide pathways to health services, as well as providing alternative services and activities, all while empowering individuals, service users, and the community. The community-based FRC is designed to be a safe space, free from judgment and stigma, which is important for those who may not access traditional health services due to fears of encountering mental health stigma. Again, I just want to say a massive congratulations to everyone who's been involved in the development of this framework. It's a huge milestone today for everyone who has been driving social prescribing forward over the last number of years. I want to wish everyone the very best and thank you.
Hello everybody, my name is Jennifer Darcy and I work with Bray Area Partnership. I am here speaking today on behalf of the Irish Local Development Network, which is the representative body of Ireland's 49 local development companies. Some of you may know them as leader companies or partnership companies. Local development companies are multi-sectoral partnerships that deliver community and rural development, labour market activation, social inclusion, health and well-being, climate action and social enterprise services. With over 2,000 employees and just under 10,000 labour market scheme workers on the ground in the communities, we support approximately 15,000 community groups and 173,000 individuals annually. With over 300 million in state-funded programmes, it is the largest community development anti-poverty network in the state. Bray Area Partnership has been delivering social prescribing for just over 2 years now. And just looking at some of the experiences from delivering social prescribing in the area, thinking about what has helped with supporting the role out of social prescribing in the community, I suppose one of the key things is that local development companies are concerned about people and their personal journey, working with the whole person and assisting individuals in their personal journey to help them fulfill their goals. Our work is underpinned by a collaborative approach, engaging with a broad range of stakeholders, including target group individuals and communities, local authorities, businesses, and statutory agencies. We have found that having a strong locally based structure to guide the direction of the service is so important. So, for example, the collaborative approach that we speak of, we have an expert group consisting of representation from local community groups, HSE, health and wellbeing, primary care teams, KWETB, and more recently, a retired GP has come on board to help guide the work on liaising with GPs. Our work is social inclusion focused. As a result, we have years of experience engaging hard to reach and disadvantaged groups and individuals. The wraparound support available through the local development companies, through the plethora of social inclusion programs that we operate, has been really, really crucial in terms of dealing with, I suppose, as Orla had referred to, the wider detriments in terms of health and well-being. LDCs have substantial experience in establishing and delivering a range of community-based programs, focusing on enhancing community connections and improving health and well-being, including social prescribing, healthy eating, smoking cessation programs, all programs that are easily replicable across nationally. LDCs are currently hosting a number of social prescribing services funded from a range of sources, including Healthy Ireland, Sláinte Care, the Rural Social Scheme, and SICAP. We have robust corporate governance structures in place to support the rollout of social prescribing, and that's been really important when a social prescriber comes on board within a service, to have the support from other colleagues who are used to working with more marginalised, disadvantaged groups, and it can provide support, especially when looking at other factors for individuals, things like overcoming housing issues, poverty, unemployment. It's been great to actually link in with the support services that are available through the local development companies, such as employment services or early intervention or prevention services. Local development companies have an in-depth knowledge of the local community in terms of local community groups, services and supports, facilitating two-way process of referral in and out of services. We have a really strong record of delivering evidence-based programs. This ensures fidelity to service delivery models and evaluation frameworks. We've worked with other local development companies to pilot the use of the Elemental software system, and this has been a really exciting development over the past 12 months to capture the work undertaken in our social prescribing services. Social prescribing has worked really well in our area and for our clients, because we're able to work not only with the statutory services and supports that are available through agencies such as the HSE, but also utilising the suite of supports available through our social inclusion focused programmes to provide the wraparound supports necessary to help individuals along their health and wellbeing journey. We are delighted to have contributed to the HSE Social Prescribing Framework and look forward to continuing to support the role of the social prescribing within our communities. Can I just say a special thank you to Orla and to Anne in relation to guiding us and the Social Prescribing Steering Framework Committee to producing the documents that we have today, and it's certainly exciting times ahead. Thank you.
Thank you, Jennifer and Shauna, both of whom, as you heard, represented their organisations in the National Steering Group. And I mean, there's absolutely no doubt that both organisations will play a key role in the further implementation of social prescribing as we go forward. And there's been a lot of reference to healthy communities, and I just wanted to clarify that this is a Department of Health initiative focusing on areas of disadvantage, but you will hear more about that from the Minister, who I think his video is ready to go now, and also from our panellists later on. So I'll hand over to the Minister to launch the framework.
Good morning, ladies and gentlemen, and I am very pleased to have the opportunity to launch this new framework for one of the most exciting and growing areas of healthcare, social prescribing. All of you here today will be familiar with the themes and action areas in the Healthy Ireland framework. And at the core of the framework is the recognition that if we are to improve the health of the population, we must consider the social determinants of health, those key factors that impact upon health and well-being. These include the circumstances in which people are born, grown up, live, work and age, the degree to which people are socially connected with friends, families, and the wider communities in which they live is a key factor influencing well-being. Social prescribing is one of the means by which we can achieve a greater degree of social connectedness for people and counteract isolation, thereby improving mental health. Additionally, by using social prescribing, if we can empower people to find their own solutions for health and well-being, the potential benefits can be enormous. Social prescribing is a simple and yet profound idea, linking patients in a primary care with sources of community support and social interaction, which can include arts and creativity, physical activity, peer and group support, green activity, men's sheds, computerized therapy, and many more. Social prescribing began formally in Ireland in Mayo and Donegal back in 2012 and 2013, and is now embedded in the work we do in the delivery of Healthy Ireland and the HSE and their many partner organisations. It is named as a priority in the programme for government, in our mental health policy, sharing the vision, in the HSE Healthy Ireland implementation plans and the HSE service plans. So the policy context for social prescribing could not be stronger. The past 6 or 7 years has seen a mushrooming of social prescribing projects all over the country, with about 40 active projects at the moment. These are characterised by partnership working across sectors supported by committed, dedicated and highly skilled social prescribing link workers, or social prescribing coordinators as they are sometimes called. The commitment of family resource centres, local partnership companies and community development projects in recruiting and supporting social prescribing has been and will continue to be a key element of the success of social prescribing. I am delighted that the Sláintecare Healthy Communities Initiative, which aims to promote the health and well-being of people living in disadvantaged communities, will be integrating further upscaling of social prescribing initiatives. This will provide a sustainable way forward for social prescribing and ensure that those most in need have access to this important service. I would like to take the opportunity to congratulate everyone involved in developing the framework. I know that a national steering group provided the advice and guidance, and that the extensive consultation took place with all stakeholders, both at HSE and community and voluntary levels. The framework provides a roadmap for how social prescribing can flourish. At the end of the day, social prescribing is all about the person who for various reasons feels lonely, isolated, lacking in confidence, anxious or depressed. The person who feels his or her life is out of their control and who has withdrawn from social contact and social life. Social prescribing can be the catalyst that helps a person take the first steps to regaining control and help them get back into the driving seat of their lives. Once again, they have embarked on this journey, other opportunities become possible, that they can have a profound positive impact on their health and well-being. And it only remains now for me to once again congratulate and thank all of those who have worked so hard to make social prescribing in Ireland such a success. In particular, I want to thank Anne Sheridan, Orla Walsh and all their colleagues from the HSE Health and Wellbeing team, the members of the National Social Prescribing Steering Group and the many staff working at community level, both in the HSE and in the many agencies and voluntary groups that support their valuable work. Your work has helped many people in transforming their lives for the better, and I have no doubt that this new framework will make a huge contribution to building on this work and supporting people to live healthier and happier lives into the future. Thank you.
Thank you, Minister Feighan, for such a lovely presentation and for launching the framework. And as he says, the policy context for social prescribing has never been stronger. So this augurs really, really well, I think, for the future of social prescribing in this country. So next up is Dr. Dara O'Keirda. He's a GP in Tala, And he is such a strong advocate for social prescribing that his practice actually employs a social prescribing, their own social prescribing link worker. So again, this is a pre-record, so I ask you to sit back and listen to Dara. Thank you.
So this is something that we have been engaged with as a practice for 5 years now. And I suppose it started from a realization that, we felt that we were seeing, many of our patients very, very frequently, far more frequently than really you'd expect, given, say, an underlying condition or their age profile or so forth. So it really, begged the question in terms of, well, what really is, what was going on with people's lives, that they were coming to us, and oftentimes I think looking for assistance, looking for answers. And the other feature was of a lot of our consultations were I suppose, how prevalent, socioeconomic and environmental issues were, be it issues around housing, employment status, presence of addiction, either with the individual or in family, difficulty accessing services, and unemployment, and people looking to get back to work, and a whole host of issues really, and many of which we just didn't have an answer for. So we, at the same time, one of our team, Brenda Nolan, so Brenda joined us and has a background in social science, and has worked locally with Peter McVerry Trust and youth groups here in Tala, and had a real interest in furthering her career in terms of the skills and experience that she had. So look, we figured that this was an ideal opportunity to try something. So we gave our version of social prescribing a go, and we set Brenda a task of spending 3 months researching all the available resources in the area. We've now identified up to 350 different resources in the West Tala area that our patients can avail of, and it spans the range of services. Essentially how the process works in the practice is that if I identify a patient, and we'll take an example of let's call this patient Mary for purposes today. So Mary is a patient who's presented on multiple occasions, really with low mood. She's bereaved a number of years ago, and really feeling quite isolated. And so I referred Mary to Brenda for a one-to-one assessment, and Brenda was able to identify and pick up on this idea of isolation and loneliness that was having a real impact. And actually we discovered that just across the road from where Mary lived was a knitting group. So where a couple of evenings a week, people would convene and knit and have chats, and work meet in a convivial atmosphere, and that really helped Mary in terms of filling some of the gaps in her life, and we did notice certainly an improved mood and an improved engagement. Other examples would include, many of our men, for whatever reason, again, have lived quite isolated lives, and the presence of men's sheds or other kind of men's groups have been really helpful. and again have I think allowed some of our patients then to develop a bit more of a sense of purpose, something to engage them during the week, something to look forward to. And I think that can have a very positive impact on somebody's well-being. And so then we started looking back at our data and figuring out, well, who within the practice ended up availing of social prescribing. So after the 3-year period, for example, we looked back, and really interestingly, the cohort of patients who availed of social prescribing were often those who attended very frequently. I think the average consultation rate was somewhere between 11 and 14 consultations per year prior to commencing on the social prescribing program. And then when we looked at medication use, we saw that there was a preponderance of mental health medications and analgesic medications amongst the patients who availed of social prescribing. And interestingly, and it may be reflective of our own demographic a little bit actually, but the largest cohort age-wise were in the 19 to 44-year-old age bracket. So really, we're dealing with young adults who have a whole range of socioeconomic and socially determined difficulties, who avail now of social prescribing and who are signposted to resources to assist them. And I think the sense that we get is that we are actually able to fulfill to some extent what was previously an unmet need, but an unmet need that was kind of played out in terms of maybe medication use, maybe in terms of frequent attendance with ourselves in the practice. And we're able then to see, because we keep records then in terms of what services people are utilizing or being signposted to, and we are seeing heavy use of services around mental health and counselling, bereavement supports, isolation, loneliness supports, housing supports, kind of back to education resources, and domestic violence supports. So it really gives us addiction supports as well, and it really gives us a flavour in terms of actually what the specific needs of the community are. And I think, look, every community will have a different profile depending on socioeconomic factors, on demographics in a particular community. But I think social prescribing, gives an excellent overview of what maybe some of the unmet needs are. And at its core really is, I suppose, what we're trying to do is trying to connect people with the social capital that does exist in every community. But the problem with social capital is that it's often unhidden. So if we go back to Mary's case, she did have a knitting group that was just across the road from her, but she didn't know about it. And then as GPs, we didn't know about it. So it really needed the social prescribing piece, the link working piece, to actually connect the patient with the service. From a GP point of view as well, it's been a fascinating journey, and I think one of the biggest challenges for us previously has been, trying to deal with the consultation where there are seemingly intractable problems, and that can make for a difficult conversation or a consultation when you don't have ready answers or ready solutions. I think as GPs we're hard find to problem solve, and prior to social prescribing, I think this was, this was difficult. But now that we have the ability to link our patients in with social prescribing, I think it changes the dynamic in the consultation. I think it lends itself to a more positive interaction in a way, and in terms of the Pandora's box maybe can be open, and I think that there's a very important validating piece there for the patient as well. And I think it is protective of empathy actually for GPs, particularly working in areas of significant need and deprivation. So it's a protective factor. And ultimately, what was really interesting is that, when we look back and we look at the consultation rates of those who attended social prescribing, who availed of social prescribing, we found that the consultation rates of patients fell by just over a third. So that has significant positive knock-on implications for the practice and for the patient themselves, in terms of, really, we're hoping it means that they've found additional supports and resources that really work for them. So with the launch of the HSE Social Prescribing Framework, I think this represents a great step forward, I think, for social prescribing in Ireland. And I would really recommend to GPs, if an opportunity presents itself to your practice, to get involved in social prescribing, to avail of a resource, then I would wholeheartedly recommend it and advise that you seize the opportunity with both hands. And I think both your patients and yourselves as practitioners will see the benefits. Thank you.
Anne, if you can unmute yourself, please.
I knew that would happen at some stage. Thank you. Dara's input, thanks to him, I think really highlights the win-win of social prescribing. It highlights the benefits for GPs as well as for the patients. And I think it also highlights the potential of social prescribing to actually result in not only enormous benefits for people, which is what it's all about, but also cost savings as well into the health service. And of course, the framework highlights not only the importance of GPs as a potential referral source to social prescribing, but all the other myriad of health services, clinical services and other services within the HSE that we really want to strengthen the pathways so that as many people as possible who can really benefit from social prescribing get the opportunity. So just to say, GPs will continue, of course, to be key stakeholders, and we are engaging with the Irish College of General Practitioners, and we really look forward to strengthening those connections in the future. So now we're going to hear from another person, Mary, a young woman who talks about the difference that social prescribing has made in her life. And just interestingly, she's attended social prescribing before COVID. So when social prescribing was delivered, I suppose, in more of the traditional way. So I'll hand over to Mary. Thank you.
My GP referred me to social prescribing because she thought it was very important that I try and get out and meet people and become more active. Okay. Yeah, because my health just went down big time. Well, it was very interesting. It was very truthful, and it was an eye-opener, really. She was very helpful, of course, and she did a life cycle questionnaire with me, or to see how things actually were in my life at that time. And if that was when I realised, of course, how bad it actually was, because you don't ask yourself those questions, I was at a it was actually the lowest point in my life, really. It's because of the illness that and on large amounts of opiates, it's just that you're not thinking properly at all, nowhere near it. You're not able to look after yourself I wasn't even able to look after myself physically, never mind mentally, you know, and realising what I did need. But that day was an eye-opener, and I realised how things were. And it sort of made me more determined that I have to step forward, you know. And the social prescribing, I must say, really did drag me forward. And that's what it was like. It was dragging me forward. And I really needed it. And I'm so grateful for it, because I actually wouldn't know where I would be now at the moment if I didn't have it. I'm still in pain. I'm still in the same amount of pain, but the difference is how I am now mentally able to cope with it. Huge difference in how I'm mentally able to cope with it. And of course, the relaxation and the stress class on a Monday night teaches relaxation techniques, and we always would do a meditation, guided meditation, and teaching you about mindfulness. And the huge point of it for me was teaching me breathing techniques. So you breathe. Now I breathe my way through the pain. The social prescribing, it really helped me. It put an order to your life. It was just a fantastic guide. It opened my eyes. I hope now that they really, you know, are given I hope ill people are given the benefit of social prescribing. I think it's fantastic. I don't know where I'll be without it now. And that's it, you know. It's fantastic service, like for people that are sick and don't see any other way out, you know. When you're on loads of drugs, you just don't think clearly at all, and that's it. And you don't realise how bad your life has gotten, you know. The social aspect of it and that, you know. And of course, I didn't realise before how important the social aspect is of everybody's life. It's vital, actually. And I would never have realised that before all this, you know. But it's huge, yeah. So made some great friends and had some good laughs. Yeah, so definitely recommend it to people.
Thank you, Mary. And again, we're just so grateful to Mary and to Frank earlier on, and as you'll hear in the end, to Margaret for participating and telling us their stories, because there's just something incredibly profound about hearing the story from real people who've availed of the service. And I think what you'll realise as well is that the potential reach of social prescribing and the people, the range of the people that can benefit from social prescribing is extremely wide, and we hope that everybody who can benefit gets the opportunity in time to come. So it's a great reminder, I think, when we hear directly from people just what we're all about. It's, at the end of the day, it is all about helping the individual people to get, as Minister Feighan says, to get back in the driving seat of their lives. So we are now going to move on to our panel discussion, and I'd like to welcome on stage our panelists. And so I have, okay, so I'd like to welcome Tom James. Who is the head of Healthy Ireland in the Department of Health, to Derval Howley, who is head of service for health and wellbeing in Community Health Organisation, to Dr. Siobhan Yvrian, who's lead for integrated care in the HSE, to Dr. David Robinson, who is consultant geriatrician in St. James's Hospital, and Helen Deely, who is Assistant National Director in Health and Wellbeing. You're all really welcome, and thanks for joining us here this morning. So I'm going to start with one question for all of you, and I'm keeping an eye on the questions that are coming in from the audience, and so we may have another one for you at the end if we have the time. But Tom, I'm going to start with you, if that's okay. We've heard a lot of reference this morning to the Healthy Communities Initiative, the Sláintecare Healthy Communities Initiative, which is an important development, obviously, supporting a range of health and wellbeing programs, including social prescribing. We know that this involves 19 sites across the country this year, but how do you see this initiative rolling out in the years to come?
Thanks, Anne, and I suppose first, thanks for inviting me today. It's really a privilege to be on a panel with such esteemed colleagues. I'm wondering how I got the invite, but as you mentioned, I'm the head of Healthy Ireland in the Department of Health, and very recently appointed. So myself and the Healthy Ireland team and the Sláintecare team, we're really excited about the rollout of the Healthy Communities project. So as you mentioned, social prescribing is a key element of the project in terms of one of the initiatives that's been rolled out. But I saw there was a couple of questions in the Q&A around the 19 sites, etc. So I don't propose to read out the locations of the site, but maybe just talk briefly about how they were chosen. So the concept behind the Healthy Communities project is that we will address health inequalities in the poorest of the communities around the country. So we're looking into the SICAP areas, which everyone will be familiar with. And in terms of the initial 19 sites chosen for phase 1, we looked at the Pobal Deprivation Index. So the thinking behind it is, and we've worked with the LGMA and the local authorities on this to identify, I suppose, the little nuances on a local level, but we're going into the, I suppose, the most deprived communities in the SICAP areas in phase 1. And we all know that like health inequalities exist in these areas, and there's a higher prevalence of chronic illness and disease and a whole plethora of other health and well-being issues that exist when compared with the general population. So we've been working closely with our partners in the HSE, with Helen Dealey and her team, with other government departments and agencies, with the local authorities, with the local development companies, and indeed the community and voluntary sector. And I think one of the questions as well in the Q&A talked about social prescribing perhaps straying into other areas, and I think it was answered verbally, but just to reiterate, social prescribing and indeed the Healthy Communities project is not about us putting people in to do jobs that are already there, far from it. It's actually about identifying the services that are offered by the various state bodies, by the HSE, by the departments, by other agencies, by community and voluntary sectors, by the great work that's been done by the area partnerships like Bray Area Partnership that we heard from earlier on, and to be able to point people to the services that are there and to put a coherent structure in these most deprived of communities. In terms of where it goes from here, obviously everything is subject to budget approval, but certainly the direction of travel and the plan is that we would roll out phase 2 in 2022 to probably another 18 or 19 of the SICAP areas, and all things being equal, then we would roll out the final phase 3 in 2023 to the balance of the SICAP area. So I hope I've given a very kind of quick bird's eye view of the Healthy Communities project, what it is and what it isn't, and how we hope it can grow over the coming years.
Thank you very much, Tom. I think the audience will be delighted to hear that we're not just talking about something that's going to happen in 2021, but actually there's the longer term view, and that social prescribing is here to stay, and it's going to be a core feature of the Healthy Communities initiative as that goes forward. I might move on to you, Derval, because as head of health and well-being in a community health organisation, you're going to be taking, if you like, the lead really on kind of implementing social prescribing at a local level. And I know, like ourselves, you're all delighted, you and your colleagues are delighted that we've reached a stage where we now have a national social prescribing framework. But I'm curious to just ask you, like, what do you think this will mean on the ground in relation to securing resources for social prescribing become a really accessible support for individuals in communities?
Fantastic. Thanks a million, Anne, and delighted to be here. A really exciting time for us as heads of service in health and well-being. Although we're coming through the pandemic, the likes of which we haven't seen in 100 years, we can feel that level of support in terms of resources and hope for the future in relation to health and well-being. Tom has outlined there in terms of healthy communities and sustainability in relation to the ground. So I can kind of talk in terms of from a Southeast as an example. At the moment in the Southeast, we have 3 counties which have social prescribing initiatives, some funded through Sláintecare and some through the Healthy Ireland's committees. They've been our kind of seedlings and to the fore in terms of leading the way and proving the value of social prescribing on the ground. It's from the likes of those services, and as Orla described in terms of Mayo and Donegal to the fore, that we've been able to build the case, and that business case is really the essence of the framework. So Orla mentioned there at the start in terms of the longer term vision for what we'd see on the ground, being a social prescriber in each of the 96, so almost 100 social prescribers right throughout the country. For ourselves on the ground, in terms of what healthy communities means, within the Southeast, we'll have 11 community health networks. So based on the business case, we'd like to see in terms of as that becomes fully implemented, that you'd have a really strong team and network of social prescribers around that kind of size of a Southeast region. The phase 1 then in relation to healthy communities for us will mean those areas, and Tom described it really well in terms of the work that went into identifying where to start. In Healthy Ireland, we look at 4 key level, high level goals, one of them being health inequalities. So that's where this started, looking at the purple maps, looking at the areas of highest deprivation. For ourselves, there's been 3 areas highlighted under healthy communities that will start as part of phase 1 this year, and that will be areas within Wexford, within Waterford City, and within South Tip. So the process now in terms of commencing is working with Sláintecare, with Healthy Ireland, with yourselves in Health and Wellbeing nationally, and drilling into those areas with the local authorities and looking to see where to start first and to give the key focus to those areas of highest deprivation. So that work has commenced. We look then in terms of phase 2, and I know a number of our sites are, and I can see in terms of the questions and answers, Carlo and Kilkenny, they've also got projects that are currently being funded through either Sláintecare or Healthy Ireland and the LCDCs. So it's the likes then in terms of looking at phase 2 and phase 3, but the ultimate aim, and we will be working towards over these 3 phases to implement social prescribing in almost 100 sites, but covering the entire entirety in terms of the health service.
Thank you, Derval. I mean, I think that's going to be incredibly positive for people on the webinar to hear. The future looks really positive.
It does.
So that's fantastic. Siobhan, moving on to you. First of all, thanks for being the person to kind of endorse social prescribing from a clinical point of view within the HSE. And I think that's been really important, because what we want to see happening is the integration of social prescribing across clinical services. So, and the success of social prescribing relies on a range of health professions, including GPs, but also other mental health services, having clear referral pathways. What do you think are the critical factors that support referrals from clinical services, and what can be done to strengthen this as we go forward?
So Anne, thanks very much. I'm really delighted to be here today. As you know, I've been involved on and off with social prescribing for the last 5 or 6 years, and sort of lost contact for a little while. So it's just fantastic to be back here and be, involved in launching this and supporting it through the clinical programs. I think it's very important that there's awareness. That's the first thing among clinicians, so that they know to refer to it. In many ways, I think we're almost at the perfect time to launch this because of the effects of the pandemic on people in terms of social isolation and the anxiety associated with the pandemic. And very interestingly, particularly my own background, we're seeing that people are struggling as much with the lifting of lockdown as they did with lockdown in the beginning, and the anxiety about the Delta variant and so on. So it's been a really, really difficult time for the population over the last 16 months. There's no doubt about that. And the impact on people socially, psychologically, emotionally, and physically has been enormous. One of the things that I think people don't always realize is that the determinants of good mental health are really very much the same as the determinants of good physical health. So if you've got one, you're very likely to have or be on the road to having the other. And I absolutely loved Deirdre's description of the green prescription in the beginning. That's an incredibly effective way of improving your physical and mental health. I also thought from Frank and Mary's absolutely gorgeous videos, they really showed the importance of social contact and social isolation. And to say to Frank, I too learned how to use Zoom in the beginning of the pandemic, but I think his use has been much more imaginative. So I'm now going to suggest to some of my colleagues that maybe we should be doing our Zooms on walks and not sitting down in a corner for a good while. But going back then to how we make people aware of this, you know, locally, what I'd suggest people do is identify a couple of clinical champions, be that a general practice or perhaps the clinical director of a mental health service who will support you to find a consultant who'll probably champion this. And certainly, Anne, as you probably remember, that's what we would have done in Tala. So that's one way of going about it. The other way nationally, and again, Anne, you know, and team, we can talk about this again. I would be more than happy to have you speak to our clinical leads, so they can engage amongst their clinical programs as ways we can do this. I think the bottom up is most important, and that is identifying people locally to champion it. But we can also identify people at a national level to champion this. So there are some of the ways I'd suggest we go about it, and we can certainly make contact again to manage that. The other thing, of course, that can happen is people can ask for it themselves. So the more awareness there is of social prescribing, the more individuals can go to their GPs or their pharmacist or their public health nurse or wherever else, you know, their sources of referral, and say, I'm interested in this, and, you know, could I be referred for social prescribing? So I think how we sort of ensure success in terms of referral is both bottom up and top down. So thanks I hope that answers the question, Anne.
Yeah.
Or answers the question. Thank you.
Thanks, Siobhan. Yeah, that's really good. Yeah, no, I think you've answered really well. And I think thanks for acknowledging their self-referral, because I think that's a really important feature of social prescribing that we always want to encourage. And indeed, it's referenced in the framework as well, that not only the referral pathways from other clinical people to refer, but also that people are enabled and can always access it themselves. And we'll be delighted to take up the offer of doing an input with the national clinical leads. And look forward to following that up with you later.
Yes.
Okay. Now, I suppose one of the things that the framework was trying to do as well was to acknowledge that, look, we are who we are with social prescribing right now, but other models of social prescribing will evolve over time. And indeed, there's a lot of talk at the moment about social prescribing for young people. But David, to move on to you, you've been piloting a unique social prescribing project in St. James's Hospital. So that's the first time that we've seen a project actually based in an acute hospital, targeting older people who are patients of the hospital. So you might tell us about just some of the early findings or early feedback from that study. And if I could ask you then maybe to move on and deal with the second part of the question. You're co-chair of the All Ireland Network, which Orla referenced in her presentation. That's the All Ireland Social Prescribing Network. What role do you see that the network can play in the development of social prescribing as we go forward? 2 bits to your question, if you don't mind.
No, thanks. So I'll answer the first question about outcomes. Firstly, thank you, Anne, for asking me to participate in this, and congratulations to yourself and Orla. Really fantastic piece of work to see this come, because I know you were involved in delivery of the programme on the ground in Donegal, and now you're involved in rolling out nationally. So it's a fantastic achievement. Thank you very much. In terms of our experience at St. James's, firstly, common to all social prescribing projects, some of the challenges throughout the COVID pandemic have been that a lot of the community supports have shut down. And to echo what Tom was saying about the purpose of social prescribing isn't to replace any supports that are in the community, but rather to link the person into those supports to address health and well-being and the social determinants of health. So we've had that in common with all other social prescribing projects. Also, digital inequality has come out as a big issue in our experience. You know, people don't have, one of the participants earlier mentioned learning how to Zoom. So you have to have the technology, you have to have the skills, and you have to have the broadband in order to participate in these things online. So that was one thing. In terms of our project in St. James's, because it had a very clinical perspective, we were able to examine a lot of the participants that come in. We've had over 100 referrals since the start of the pandemic, and they're all in people over 65. 40% of them have dementia, are living with dementia, and half of those people live alone. one in 6 had mental health issues was the main reason for being referred, whereas about 40% had social isolation as the main reason for being referred. So social isolation and loneliness come out strongly in this group as well. And then in terms of what we've been able to do in the hospital, there's 4 main areas. First is keeping people at home. We've been referring to a healthy age-friendly homes program that uses a patient assessment and technologies to allow a person to stay at home. Because of the amount of dementia in this person population, and we've linked in with a couple of dementia-specific supports in the hospital. That's the first area. The second area is keeping people out of the emergency department. Our social link worker has a background in nursing originally, Bernie McGowan, and she's comfortable in referring people into some of our clinical outpatient services or our day hospitals. So keeping people out of hospital has been a second thing. Our third thing is user feedback. We've had very positive user feedback. We haven't done any structured surveys, but we've very positive user feedback to date from participants in the program. And then the last thing that's really come out of it strongly is collaboration. So the whole point of social prescribing, I think, is to link 2 different sectors, the health sector and the community sector. And the link worker is key to that. And as somebody said earlier, it's more than signposting, it's holistic. So in what we've been able to do as a hospital is we've collaborated with IMA in terms of green prescriptions. We've introduced biodiversity walking tours. We've collaborated with Dementia Services Information Development Centre, that's for teaching sessions around social prescribing for carers, and with Creative Life in our hospitals. So we have a Creative Life pillar in Mercer's Institute for Successful Aging, where we link people into participating and in both enjoying and also producing art, whether it's music or life stories or whatever. So no, and in terms of that's all based on pre-evaluation. As the project evolves, we look at post-evaluation, we look at things like clinical outcomes. So it's been very, very positive. And I think it just demonstrates, you know, that while primary care is the main focus of social prescribing, it has a role in the acute sector as well. So that's the first thing. And in the second thing, in terms of the network, and I saw there are loads of questions about link workers, how many link workers around the country, is there an FRC in Galway? The social prescribing network answers a lot of those questions. We've been working hard on terms of reference. A website is going to go up. As you know, and from participating, it's basically a loose collaboration of service users, service providers, academics, people from the community and from the health sectors, who basically just knock their heads together a few times a year, try and disseminate best practice. As you know, I mean, it's been a channel for helping influence the likes of this framework development, and also channel for communication around best practice. So for instance, there's a link worker subgroup where they disseminate best practice and experience. So I think the network has been, like in the UK, I think the network has been essential, particularly for that ground up, because social prescribing is very much a ground up approach. I think the ground up, top down thing worked very well in the social prescribing network, and one of the products of that is the framework that's being launched today.
Thank you very much, David. Yeah, great. Okay, Helen, over to you for a moment. So look, the framework that we're launching today, and thanks for all the support that you've provided in your role around that, marks, as Philip said, a really important milestone in the social prescribing journey really in this country. And I think that it identifies that health and wellbeing as taking the kind of national lead and providing, if you like, a national home for social prescribing. It's been looking for one of those for a while. So we're really pleased that health and wellbeing has taken that lead. So I'm just wondering if you could chat a little bit about just how you see this working in practice, and what do you think will be the key supports that will be provided by your office in kind of the national role?
Thanks, Anne. And first of all, I have to say congratulations on today. It's been a wonderful event, and congratulations to everybody who has supported the development of this framework. But I suppose in particular, I really need to say a big thank you to yourself and to Orla. And I suppose it wouldn't have happened without your determination and commitment. So well done. It's great. And we're delighted to be at this stage of the event. The The speakers today have outlined, you know, the strategic context in terms of our health and wellbeing work, you know, how it's built on government policies and strategies. And really that's set out in the Healthy Ireland framework, you know, which really emphasize the importance of prevention and building and supporting people's positive physical and mental health across their lifespan. So that's really important in terms of context. And then, you know, Orla and the ministers and Tom alluded to the programme for government that really sets out a commitment over the next number of years to improving and promoting people's general health and well-being, and to support them around leading positive lifestyles and changing lifestyle behaviours if that's necessary. And social prescribing gets named as part of the work that's going to be set out to achieve this. And this is reiterated then again in the Sláintecare implementation strategy and action plan, you know, again, where this addresses the commitment around supporting people's health and well-being, but also in the context of providing, you know, safe, efficient and effective service for our service users. And it talks about providing that service, you know, at the lowest level of complexity, where people can access service easily and in a timely fashion. And social prescribing is a perfect example of this, a service that's delivered in the community by community and voluntary groups. And what we're hoping to do in the HSE is to support the delivery of this service by ensuring that these services are delivered to high quality, delivered in a standardized way, and also that they're delivered across the country. And the other thing that we need to do is to set out how we're going to measure the effectiveness of any of the services we deliver. But I suppose one of the key things that's set out in terms of the Healthy Ireland Strategic Action Plan is really around focusing on the social determinants of health. And all of the speakers today, you know, have really emphasized the importance of trying to address the social determinants of health. And that's a key focus that drives our work in health and well-being. You know, we all know that, you know, our health and well-being is affected by our economic status, our education, our housing, our physical environment, where we live, where we work, and the opportunities that are presented to us and that we can avail of throughout our lives. And all of these factors influence our health and well-being, but also our mental health and how we influence positive mental health. So like positive mental health, you know, is where we feel that we're able to cope, we're realizing and working to our potential. We can cope with stresses in life. We feel valued and productive, and also we feel as if we're making a contribution to the people that we live with, work with, and the people that we belong to in our community. So social prescribing really helps us to reach those that are marginalized and disadvantaged within communities, and helps us to address these social determinants of health so people can engage better in society and live more fulfilled and better lives. And there are a few key ways that we're trying to achieve this. So we want to keep people well, and we want to support people to maintain a healthy lifestyle across the whole of their life. We want to provide interventions that target those who are most vulnerable and disadvantaged, and also those that are at risk of developing a chronic disease. And we want to do this in partnership with community groups and organisations, utilising all the existing community groups that are out there in each local community. So the essence of our health and wellbeing work is really around prevention and early intervention. All of this work is supported through social prescribing, where social prescribers provide expert advice and support people to engage in local community groups or in other social or health services. And each of our service users today alluded to how social prescribing enabled them to regain control over their lives and their health, you know, either by taking part in social connectedness or social groups. And look at, you know, everybody, you talk about referring and people using the web and that they wouldn't have done before, but also about changing health behaviours and uptake in terms of, you know, how physical activity can support our mental health and well-being. So the specific supports that we're going to provide then in terms of health and well-being is, first of all, we've launched the framework, and the monitoring of this framework becomes part of our HSE mental health promotion plan. We've developed a standardised job description in terms of how the role people should be employed in the role, and how the role and the work of the role should happen. We have developed and will continue to develop essential skills training for social prescribing link workers, promotional materials so that people understand the concept of social prescribing, know how to make appropriate referrals to social prescribing, and so people in local communities know about the service. We're also going to coordinate ongoing networking and learning events with social prescribing link workers at a national level. And we're also going to develop the software and implement a software package that tracks and monitors referrals and provides data on the uptake of services. And another key thing that we will do is we'll advocate for social prescribing and increased investment over time. And one of the other areas that people have alluded to is how it's so important to evaluate the impact of social prescribing. So again, you know, we're going to support this evaluation, looking at the impact and outcomes for service users, looking at the impact for community groups in terms of how community groups become more resilient, and we see an increase in volunteers and engagement in the voluntary sector, and also the impact on the health care system. So, you know, we'd like to be seeing a decrease in number of GP consultations as a result of referral to social prescribing. We'd like to see a decrease in the volume of medication prescribed as a result of social prescribing, and also a decrease, you know, in terms of bed day usage in hospital if people are getting referred and connected into the local community. But I suppose one of the key things today that I need to emphasize is the partnership working, and how important it is, you know, for us within the health service to recognize our dependence and codependence on community and voluntary organizations, and how important it is that we work in partnership with them to deliver and support people in terms of maintaining healthier and better lives.
Thank you very much, Helen. That's great. And I think it is reassuring for people to hear as well that there still will be lots of supports coming from the National Office to continue to support the development and the work that needs to happen on the ground. Thanks to all of you for participating and answering some of the questions that have been coming through the Q&A function. For those anyone who's questions in there that haven't been answered, as I say, we're going to group them together and we'll send out a response to everybody in the coming days. But for now, I'd like to wrap up the event really and say a few thank yous. First of all, thank you to all of the panelists and indeed everybody who participated today in the webinar. And also like to particularly thank a few people. Orla has been mentioned, Orla Walsh. To go back to the metaphor of the journey, Orla has been my trusted co-pilot in this journey. And anyone who knows anything about rallying will know how important the co-pilot is and the important role that they actually play. So Orla, thank you very, very much for everything that you've done to get today to where it is. To Noreen Turley, who works in communications, who has been fantastic and stepped way outside of the job she normally does to support us to get everything shipshape for today. To Helena and Jean from IMS for all that the technology support, and to Elizabeth McLaughlin, who was involved in designing the framework, which I hope you'll enjoy reading when you get a chance to see it. To the steering group, we've already thanked you all, but I want to say that again. But most of all, thanks to all of you for participating today. The final word for today, we want very much to leave with someone else who has availed of the service. And so the final person I want to introduce to you is Margaret from Tullamore. She is availed of the service in Offaly. And I'd like to thank again Amanda and Deirdre, who facilitated us to do the videos with all of the people who've used the service. The final word for me is just to say, look, I look forward to linking with you and working with many of you in the future in relation to social prescribing. And thank you very much for participating today. And final words go to Margaret.
Hi, I'm Margaret Dagnan. I live in Rochford Bridge, County Westmeath. I'm married for almost 40 years and I have 4 children ranging in age from 30 down to 24, 2 boys and 2 girls. The first mention of social prescribing was by my GP, but at the time I wasn't in, I think, a good enough place to even ask him what was social prescribing. I'd been very quiet in myself and I was trying to figure out exactly what my problem was. When the children were very young, I was lucky enough I was able to give up work when my eldest was a year old. We were over 8 years married before we had a family, and at one stage we didn't think we'd ever manage to have, due to problems with miscarriages and that I was delighted to be home with them. After my third child was born, I suffered postnatal depression, and then shortly after that I was diagnosed with rheumatoid arthritis. So between trying to rear a family and my arthritis, I stopped going out. And when my GP mentioned it, I didn't pick him up on it, but he said I did need to speak to somebody, which to me was a huge thing because I had lost all confidence going out. I dreaded social occasions. So one day I took the courage in my hand and I rang and got an appointment. And that was another big milestone, walking into the office. I had no idea what I was going to be asked, meeting people I'd never met. But from the moment I walked inside the doors of Offaly Community Development, the first lady I met, I don't know who she was, but she must have seen the fear on my face. She was going out and I was coming in. And I said, I'm looking for Amanda Caulfield. And she said, come on, I'll bring you upstairs. I was only there, I'd say, a few minutes, but it seemed like forever. But anybody who passed, everybody had a big smile and a big hello, and you know, we're just so friendly. And then I met Amanda, and that was a very emotional meeting because I was, I suppose, just happy to be at home and to put myself out there was a big thing for me. She suggested a few things that I might be interested in. I said I would try crochet. I'd never done crochet. So the first few weeks, I suppose, I just sat there kind of trying to concentrate on this and figuring out how was I going to do it, and didn't say a whole lot. Then as time went by, I got to know the group. I felt more at ease and I started to come out of myself. And from that, we had the big hello shortly afterwards in Tullamore. And normally at any function, christening, first communion, I'd be the one in the kitchen standing at the sink washing up, because that way I wouldn't have to talk to people. But that day, I put myself out and I went around and I spoke to people. And these were beautiful people. And I was delighted that I put myself out. And Amanda's boss had been looking at the video and she was asking who was the person that was moving around the room. This is what Amanda told me. So they launched Social Prescribing in Tullamore, and Amanda asked me to speak at it. And I just told my story as I've told it to you here now.